1. A 45-year-old male patient is admitted due to liver failure secondary to long-term alcohol abuse. The physician instructs the nurse to perform a close monitoring of the patient to check for hypotensive episodes. The nurse understands that, in relation to blood pressure, liver failure may cause A. Abnormal peripheral vasodilation. B. A hypoalbuminemia. C. Increased renin release. D. Increased capillary permeability. Answer: B. Hypoalbuminemia. Rationale: liver failure disables the body to maintain normal oncotic pressure, resulting to hypotension or decreased blood pressure levels. The other options do not directly relate to liver failure. 2. A patient comes into the stoma clinic for assessment. The nurse understands that which of the following shows a well-healed and healthy appearance of the stoma? A. Purple-colored or dark. B. Black and dry. C. Red and moist. D. Pale pink and moist. Answer: C. Red and moist. Rationale: a well-healed, healthy stoma should appear pink to red and moist, as these are indicators of good blood circulation in the tissues. Dark, purple-colored, or pale colors of the stoma is a sign of impaired blood supply. This can cause necrosis or death of the tissues, which usually happen within the first 5 days post-colostomy. 3. The nurse checks the stool of a patient with a new sigmoid colostomy. The stool is deemed normal if it is A. Watery. B. Formed. C. Semi-solid. D. Semi-liquid. Answer: B. Formed. Rationale: the sigmoid colon is situated in the bottom part of the large intestine. Therefore, the stool produced in the sigmoid colon is formed or solid. A colostomy installed in this area should also produce formed stool, as compared to other colostomies in different sections of the colon where the stool might be semi-solid or soft. 4. An 18-year-old female patient is now allowed to eat following a colostomy. She tells the nurse that she produces too much flatus, which is embarrassing for her. After reassuring the patient, the nurse recommends to eat more. A. Yogurt. B. Broccoli. C. Cabbage. D. Spinach. Answer: A. Yogurt. Rationale: yogurt has properties that help reduce the formation of gas. A bland diet which includes yogurt can help prevent too much gas, bloating, and diarrhea. The other options are high in fiber and may stimulate peristalsis even more, resulting to more flatus. 5. During health teaching on stoma care following a colostomy, the patient asks, "How big should I cut the wafer?" The nurse answers to measure and cut the wafer. A. About 1/8 of an inch bigger than the stoma. B. Exactly the size of the stoma. C. About 1/4 an inch bigger than the stoma. D. About 1/16 of an inch bigger than the stoma. Answer: D. About 1/16 of an inch bigger than the stoma. Rationale: the wafer should be cut about 1/16 of an inch bigger than the stoma to prevent the impairment of blood circulation to the tissues of the stoma and around it. However, the wafer should not be cut any bigger than this to avoid any leakage. 6. A 49-year-old male client comes in the assessment unit with a chief complaint of abdominal pain. The nurse starts to perform a focused assessment of the abdominal region with which of the following sequence? A. Palpation, percussion, observation, auscultation. B. Observation, percussion, palpation, auscultation. C. Percussion, palpation, auscultation, observation. D. Observation, auscultation, percussion, palpation. Answer: D. Observation, auscultation, percussion, palpation. Rationale: The patient's abdominal region should be inspected or observed first prior to any other assessment method. The inspection includes the color of the skin, example, yellowish discoloration often denotes jaundice, presence of lesions, bruises, wounds, etc. Next, the nurse should auscultate the abdomen for bowel sounds. Percussion and palpation follow and should be done quadrant by quadrant, ideally on a clockwise order. 7. A 52-year-old patient is admitted due to type A chronic gastritis. The patient's son asks the nurse, "What does type A mean?" The nurse responds that unlike type B, type A chronic gastritis is able to A. Reduce the amount of the gastric secretions. B. Make the stomach walls thinner. C. Facilitate the atrophy and destruction of parietal cells. D. Affect the stomach's antrum only. Answer: C. Facilitate the atrophy and destruction of parietal cells. Rationale: Type A chronic gastritis involves the immune system attacking the stomach cells, called the parietal cells. On the other hand, type B chronic gastritis is the more common type wherein the bacteria H. pylori thin the stomach walls and cause ulcers. 8. A 29-year-old patient came in with a chief complaint of abdominal discomfort. The physician informs the nurse that the provisional diagnosis is bowel obstruction. The first nursing action for this patient is to A. Increase oral fluid intake. B. Commence strict intake and output monitoring. C. Measure the abdominal girth. D. Start daily weight monitoring. 9. A 56-year-old male client came in with chief complaint of pain. He is diagnosed with cholelithiasis. The nurse should expect that the pain is found A. Pain in the left upper quadrant, LUQ, that is accompanied with difficulty of breathing. B. Pain in the left lower quadrant, LLQ, accompanied with abdominal cramps. C. Pain in the right lower quadrant, RLQ, with rebound tenderness upon palpation. D. Pain in the right upper quadrant, RUQ, that radiates to the shoulder. Answer: D. Pain in the right upper quadrant, RUQ, that radiates to the shoulder. Rationale: Cholelithiasis is a medical condition that involves the formation of gallstones in the gallbladder. The gallbladder is situated in the right upper quadrant. The sharp and constant pain is felt in the RUQ and often radiates to the shoulder. 10. A 60-year-old male patient is diagnosed with pancreatic cancer. The nurse understands that the most important laboratory value to monitor daily for this patient is A. Creatine phosphokinase, CPK. B. Radioimmunoassay, RIA. C. Serum glucose. D. Carcinoembryonic antigen, CEA. Answer: C. Serum glucose. Rationale: Hyperinsulinemia secondary to pancreatitis is a common complication of pancreatic cancer due to the excessive secretion of insulin from the tumor, which can affect the islets of Langerhans. Monitoring the serum glucose daily can ensure that the blood sugar levels are kept within target range. 11. A 27-year-old female patient is admitted with hepatitis B. The nurse informs the patient that she will be under which of the following types of isolation? A. Reverse isolation. B. Strict isolation. C. Enteric isolation. D. Universal precaution. Answer: D. Universal precautions. Rationale: Hepatitis B can be contracted through blood and blood products, as well as needle prick injuries and body secretions. Patients with hepatitis B should be nursed using universal precautions such as wearing appropriate personal protective equipment, PPE, which includes gloves and gown. 12. A 40-year-old male client is about to undergo cholecystectomy. He is concerned about activity after the surgery. Which of the following is a correct response from the nurse? A. Do not move for at least 24 hours. B. Turn from side to side every 2 hours. C. Lie flat on the bed for about 48 hours. D. Sit up straight for most of the day. Answer: B. Turn from side to side every 2 hours. Rationale: after cholecystectomy, the patient needs to improve or maintain good muscle tone, as well as efficient blood circulation and respiratory function. Therefore, the nurse should tell the patient that he will need to turn from side to side at least every 2 hours. This can also help avoid venous stasis. 13. Christine has undergone a colostomy procedure and has recovered well. The nurse is about to perform health teaching on colostomy care prior to her discharge. The nurse tells the patient that initially the stoma A. should appear dark in color. B. may have a bluish discoloration. C. may bleed slightly when touched. D. will become more swollen. Answer: C. may bleed slightly when touched. Rationale: the surgical site is still new, so the stoma may slightly bleed when touched during the first few days to a week following surgery. However, the nurse should inform the patient to report any signs of profuse bleeding or infection immediately by calling the colostomy nurse or clinic. 14. A 62-year-old female patient comes into the emergency room with acute upper gastrointestinal hemorrhage. The first nursing actions to be performed should be to A. treat shock. B. treat hypovolemia. C. control the bleeding source. D. insert a nasogastric tube. Answer: B. treat hypovolemia. Rationale: the patient with acute upper gastrointestinal hemorrhage is at high risk for severe deficient fluid volume or hypovolemia due to blood loss. If left untreated, hypovolemia can result to shock. Therefore, the immediate nursing actions must have a goal to treat hypovolemia. Controlling the bleeding source should be the next goal, but this needs decision-making from the patient or next of kin. 15. Peter presents with jaundice, nausea and body malaise. He is diagnosed with hepatitis B. Which of the following is an appropriate nursing intervention in relation to his current condition? A. Eat small, frequent meals and have rest periods after. B. Consume a low-protein diet. C. Encourage to increase exercise. D. Affirm that he can choose any food he likes. Answer: A. Eat small, frequent meals and have rest periods after. Rationale: the patient has fatigue due to body malaise or general weakness as well as nausea. Therefore, he should aim for small but frequent meals to avoid nausea and have rest periods after eating to avoid expending too much energy. 16. A 54-year-old male patient is scheduled for colostomy following colorectal surgery for a malignant tumor. He tells the nurse that he feels really anxious about the colostomy. The nurse appropriately responds by A. showing pictures of colostomies. B. referring the patient to a colostomy specialist nurse. C. using open-ended questions to assess the patient's knowledge about colostomies. D. give written information about colostomies. Answer: C. Using open-ended questions to assess the patient's knowledge about colostomies. Rationale: using open-ended questions to assess the patient's knowledge about colostomies can help relieve anxiety. The other options can also help in the care of this patient and should be considered as next steps in his nursing care. 17. A 49-year-old male client is being prepared for bowel surgery. To reduce the number of intestinal bacteria, the physician prescribes an antibiotic. The nurse understands that the synthesis of what can lead to low prothrombin levels in relation to antibiotic therapy? A. Vitamin K. B. Vitamin C. C. Vitamin A. D. Vitamin E. Answer: A. Vitamin K. Rationale: in this scenario, antibiotic therapy is aimed at reducing the intestinal bacteria for bowel surgery. Antibiotics can reduce the intestinal bacteria that synthesize vitamins K, B12, and other nutritional substances. 18. A male client is about to undergo colonoscopy. During preparation, the nurse explains that during the procedure the patient should initially assume which of the following positions. A. Prone position with elevated upper body. B. Left side lying position while bending the knees. C. Supine with straight legs. D. Right side lying position with straight legs. Answer. B. Left side lying position while bending the knees. Rationale. The initial position during colonoscopy is left side lying position while bending the knees. This can help stabilize the position of the patient and enable the endoscopist to navigate the areas properly. 19. A nurse is creating her nursing care plan with a nursing diagnosis of fluid volume deficit. The nurse understands that which of the following conditions is applicable for this diagnosis. A. Appendicitis. B. Gastric ulcer. C. Pancreatitis. D. Cholecystitis. Answer. C. Pancreatitis. Rationale. In acute pancreatitis, the patient experiences fluid shifts, which can cause hypovolemia and corresponds to the nursing diagnosis of fluid volume deficit, FVE. If left untreated, the patient is at high risk for hypovolemic shock. 20. A 52-year-old client is rushed to the emergency room with upper gastrointestinal bleeding. Which of the following diagnostic tests is expected to be done first? A. Upper GI series. B. Hemoglobin levels and hematocrit. C. Arterial blood gases. D. Endoscopy. Answer. D. Endoscopy. Rationale. The most effective way to directly evaluate the upper gastrointestinal tract is to perform endoscopy. About 90% of bleeding lesions can be detected using this diagnostic procedure. Upper GI series can be performed, but has a lower accuracy rate than endoscopy. 21. Mr. Smith has undergone liver transplant. He is now on his 4th day of postoperative monitoring in the surgical unit. Which of the following nursing diagnoses takes primary focus for this patient? A. Risk for rejection. B. Excess fluid volume. C. Impaired skin integrity. D. Decreased cardiac output. Answer. A. Risk for rejection. Rationale. There is always a chance of rejection on transplant patients. In liver transplant patients, the risk for rejection is high during the 4th to 10th day after the surgery. 22. A 70-year-old female client has been transferred to the surgical ward following a colon resection surgery. During rounds, the nurse notices that wound dehiscence is evident. Which of the following actions should the nurse do first? A. Inform the physician. B. Get a sterile bandage and wrap around the wound. C. Soak sterile dressings on saline and carefully place on the wound. D. Attempt to close the dehiscence by pulling the edges together. Answer. C. Soak sterile dressings on saline and carefully place on the wound. Rationale. The first nursing action in this scenario is to soak sterile dressings on saline and carefully place on the wound to prevent the drying of the tissues and avoid infection. After this, the nurse should immediately call the physician. 23. Ms. Stone has undergone ileostomy due to inflammatory bowel disease. The nurse performing the health teaching prior to discharge should tell Ms. Stone to A. Consume medications that are enteric-coated. B. Eat a high-fiber and low-protein diet. C. Wear an appliance pouch only at daytime. D. Increase oral fluid intake. Answer. D. Increase oral fluid intake. Rationale. The patient with ileostomy drains liquid waste, therefore, she is at risk for dehydration. The nurse should encourage her to improve her oral fluid intake. The appliance pouch should be worn all the time. The patient should consume low-fiber diet to avoid irritating the intestines. Enteric-coated medications should be avoided as the body cannot absorb these following in ileostomy. 24. Mr. Milano has been diagnosed with esophageal varices. Which of the following assessment findings is an evidence of this diagnosis? A. Increased blood pressure. B. Decreased urinary output. C. Increased heart rate. D. Decreased respiratory rate. Answer. C. Increased heart rate. Rationale. The right side of the heart compensates in retrograde flow in patients with esophageal varices. This results in increased heart rate or tachycardia. 25. A 56-year-old patient comes into the emergency room with gastrointestinal bleeding due to esophageal varices. He requires a Sengstaken-Blakemore tube. The nurse should monitor the patient for which of the following complications of this procedure? A. Pulmonary embolization. B. Pulmonary obstruction. C. Cor pulmonale. D. Pericardectomy syndrome. Answer. B. Pulmonary obstruction. Rationale. During Sengstaken-Blakemore intubation, the nurse should check for pulmonary obstruction. This can be a result of the deflation of the balloon or its rupture, which can obstruct the airways.